Hello, I would like to thank the American Hypnosis Association to ask me to talk today. My name is Sally McNally. I am the Irish midwife, and I would like to talk to you today about hypnosis in childbirth. So, first of all, of course, we think about the history of hypnosis in childbirth. We've all heard of Lamaze, Dr. Ferdinand Lamaze back in the 50s. Then in the 70s and the 80s, we had hypnobirthing, the Mongan method with Marie Mongan. Then, of course, Dr. John Kappas gave us all our gifts here at the Hypnosis Motivation Institute. And Lisa Mackenberg, that you've just listened to, I did my own training with her. She teaches the Hypnosis in Childbirth certification course, and you can do that online here with her through the Hypnosis Institute. And then me, Sally McNally, and I have a special wonderful opportunity to be with women throughout their pregnancies, throughout their labour, throughout their birth. It's my job. But I have this great interest in hypnosis and childbirth because the women who use hypnosis, self-hypnosis in childbirth, have really good outcomes. Whether they end up having an epidural or a cesarean section or a beautiful, natural, normal experience, they usually tell me that they don't feel traumatized, they have good memories of their birth, and I see them needing, of course, less medication, they have less cesarean sections, and they're able to stay at home in labour quite a longer time rather than to be in the hospital, which is a good thing, which we'll talk about later. So when we talk about Lamaze, what is Lamaze? So it was great because Dr. Lamaze was interested in hypnosis, and he came up with this great way of combining breathing techniques with distraction techniques and hypnosis. So an example of that would be a woman in labour could use the technique of a finger up would be a he and a closed fist would be a who. So a distraction technique for her could be two he's to one who that her birth partner could use, or her midwife or her doula, the nurses could all bring this to her. So the contraction would start, she might take a big deep cleansing breath, and then we would launch into he, whew, and she would focus on that. If it's a finger up, it's a he, a closed fist is a who. And then later in the labour, when the contractions get stronger and longer, she might have more of a scrambled pattern where the person helping her in labour would maybe do a pattern something like this. A finger up again is a he, so it would look something like he, who, he, who, he, who. So she doesn't know what's going to come, but the contract between her and the helper is that if it's a finger up, it's a he, and a closed fist, it's a who. So the person doing it makes it up as they go along. And this gives her mixed messages, which gives her an overload, and then she falls into hypnosis and follows along. So it can be very, very helpful. It gives her that hyper-suggestibility state. And then Maria Mongan was the lady who came up with the hypnobirthing, and she came up with really some great ideas, and we use them. I teach this class at the hospital where I delivered the babies in Ventura. They came up with a childbirth education course that you can take, helping the women to understand what their fears were. And then, of course, the different breathing techniques she can do throughout the labour. There's a calm breath, then there's a surge breath that she does with the contraction. And then there's a J-shaped breath where she exhales and breathes down the baby. So they're very interesting, they're very different to what we would learn usually in a normal childbirth class. And then, of course, relaxation, how to do deep relaxation, progressive relaxation, and instant relaxation. So when we think of a woman in labour, she has a contraction, and then a few minutes in between the next contraction, I like to call that the relaxin. So she has a contraction, and then she has a relaxin. But as the labour progresses, that space between the contractions gets shorter. So can we train a woman to drop into that space quickly so that she can benefit a lot throughout the labour, just to deeply relax and conserve the energy to keep going? Visualization, of course. They have some very interesting visualizations for the hypnobirthing course, the inner control room, the glove of relaxation where she imagines her hand has been in a bucket of ice and she can place that cold hand wherever she feels the discomfort and numb the area. And of course, healthy living practices. She believes herself to be, a universe for that baby, and she keeps herself strong and healthy. And then, of course, here at the Hypnosis Motivation Institute, Dr. Kappas, he taught us about the convincers. If a woman goes into labour thinking she's ready to do self-hypnosis throughout her labour, she's not going to, do what she wanted if she hasn't been convinced beforehand. So we have to convince the woman that she has the ability to do self-hypnosis. And we show her how strong her mind is with some of the great ideas that Dr. Kappas has given us. The heavy light. She imagines there's a bunch of like helium balloons tied to one arm and maybe a bucket of sand tied to the other arm. And then she sees that her mind can transport her one way or the other. Also, he taught us the theory of mind, the beautiful filter between the conscious and the subconscious, and can we help her through hypnosis to coat the negative thoughts in her subconscious mind that she has about childbirth. And of course, we all have them, we see movies about women in childbirth and they're screaming and they seem so distressed and it seems like such an awful thing. And that's just fear that the poor lady is going through. But a lot of the women, when I first meet them, that's the first words out of their mouth is that it's such an awful hard thing and how will I ever have my baby? And in those movies that we see the women crying and screaming, I believe that those women have slipped down into what Dr. Kappas teaches us is the primitive area, that lower part of the mind where we run to hide or to fight, the fight-flight area, right? And an example of that for women in labour, often we come across women and they're screaming loud, high-pitched, it sounds like total hysteria. So I like to teach the woman that if I hear her doing that in labour, I'm going to copy the sound and she'll hear me dropping my voice down to a low tone. I'll go, oh, and I'll stay down in that bass low tone and she knows to follow me, to come with me, to come home, to come back to a safe place, somewhere maybe in her subconscious mind where she'll remember that she's safe in her contraction. I'll teach her birth partner that same little trick. And And a lot of women, they no words are needed, because when you're in that base primitive area, you can't be talked out of it in the middle of it. We can't say to a woman while she's screaming in labour, stop doing that, that's scary, you're scaring yourself, you're scaring me, you're scaring the woman next door. We can't do that, but we can copy her and gently invite her to come back home to a safe place. And then what's happening in labour? A woman needs to understand what's happening in her body so that she can accept that. So we teach her, of course, the childbirth education classes are very important. She must know that the uterus has the three thick layers of muscle, and some of those layers are going to pull up and out, pulling the cervix open and pulling the cervix up. It's going to thin the cervix. And then, of course, there's layers of muscle that are in like a figure of 8, and they're grabbing and squeezing around the baby. And then there's circular muscles, again, that are pulling up and away from the baby, eventually pulling that cervix wide open and bringing it behind the baby's head so that the baby can come down. So if she understands that that's what the contraction is trying to do, it's not a mean, horrible, dangerous thing. It's a wonderful gift from Mother Nature, pulling and stretching and thinning and opening. And we use words like that rather than, mean, strong, hateful, awful. The words that float in her mind from other women's scary birth stories. She must understand that her pelvis, even though it feels hard, it has joints in it, like joints in the front of the pubic bone, joints in the sacroiliac joint, and they're joined by cartilage, and this wonderful cartilage gets softer and softer as she gets closer to her due date, allowing those bones to open and separate to allow the little baby to drop down and in to the birth canal. The wee baby has a trick as well. Their bones are not fused together. They have little plates of bones making up their skull, and those bones can slip over each other. And we call that moulding. And the baby's head, even though the doctor might have been telling her, your baby's head is huge, how will you get that big baby out? But the baby's head will be narrower as it comes out, and all the soft tissue gets squeezed up to a little cone shape. That's where those cone heads come from. So we can tell her your baby's head will be narrower coming out through the pelvis, which will be wider. And then she must understand that the first stage of labour is all about the cervix. The cervix in early labour might be 6 to 12 hours. Her contractions might be really spaced out. They might come like 15 minutes apart, and they might only last 30 seconds. So we'd love if she could do that at home, and then she's not in the hospital being tempted by all the lovely epidurals that she may have decided she doesn't want. But over time, she must know that the cervix is opening. It goes from 1 centimetre to 6 centimetres, and the contractions will get longer, stronger, and they'll come more often. And that she should know that that's normal, and when that happens, she shouldn't be afraid of what's happening in her body, that's the wonderful gift of labour. And then she'd probably come into the hospital or go to her birthing place, wherever that'll be, a birth centre or maybe a home birth, but she'll want to be with the people who are going to help her birth her baby. And in the active labour now, she's doing strong work. The contractions are strong and they're long, and they're coming like every 3 to 5 minutes, and they last at least 60 seconds. And these are wonderful contractions, opening her cervix all the way to 8 centimetres. And then transition, that last little bit, wild time. It might only last 30 minutes, but she's full of hormones. She has this great big cocktail of all the hormones of labour flowing in her bloodstream. The contractions are very strong, and they're pressing the baby down into her pelvic floor. She might even get little feelings like, oh, I want to push. So if she knows what to expect, then she's not going to be so terrified of what's happening in her body. So I like to describe it for the women that you're going to the fair. And that early labour is like those little rides the little kids go around and around on little tiny safe little cars. And then the active labour is more like those chair planes where you're flying around, and it's kind of like a little bit scary but not that scary. And then the transition is like the cyclone one where you're going up and down and in and out, and it's an old crotchety kind of a ride, and you feel like all the nuts and bolts are going to fly off, and the feeling that you get is normal. You're safe. We must teach the women that they're safe in their contraction. A contraction is not a dangerous thing to happen inside your labour. It's the strong muscles pulling and stretching and opening to give you your baby. The contraction is a gift from Mother Nature, and she must learn how to say, yes, Mother Nature, yes, Mother Nature. Give that contraction to me, open my body, give me my baby. And that opening, that acceptance, rather even than a surrender, she's working with her labour rather than fighting what's happening in her body. So this is a picture of some of my own patients using hypnosis in labour. And looking at them, we can't tell which one's in early, which one's in active, which one's in transition. But they're all in this beautiful state of peace and calm. And all of them, of course, had beautiful natural births. So this is what a contraction pattern might look like. On the end of the page, if we put her on a fetal monitor, we're able to pick up contractions like this. And, you know, even these are not that strong. This is kind of like kicking into an active labour pattern. But they're like waves, aren't they? They're kind of like waves coming from the ocean. And our bodies are like the ocean when we're in labour, especially the active labour. There's a rhythm that starts to happen. And that rhythm, it's like we know that in the next moment another contraction is coming. But if that contraction is coming, the relaxing is also coming. Note, between each contraction, there's a few minutes where nothing is happening and life can be completely normal. So if a woman knows that each contraction has a beginning, a middle, that'll be the strongest point, and then the end, she knows that she's not going to be stuck in that contraction, that her mind is not telling her the truth. Some women, they start believing their thoughts that, oh, I'm stuck in this contraction forever and ever, and I'll never be able to find my way out of it. And that's not true. She is safe in her contraction. And the contraction's a good thing. I like to tell the women, think of your contraction like a female friend coming to you, coming to your house to help you get the work done. And just open the door and say, come on in. And when that friend comes, she does the work and then she leaves. And then another friend comes. So the second stage of labour, now the cervix is all open and she gets to this lovely part, the pushing. For some women, that pushing could be 15 minutes. For some, it could be 3 to 4 hours. And all of that is normal. Throughout the pushing, women should be, encouraged to know that the work is hard. Yes, we're almost at the summit. And if we're climbing a mountain, that part just before the summit, isn't that the steepest? Isn't that the hardest? But it means we're nearly there. And they have to keep going. Go get your baby. Your baby's up there at the top of the mountain. So the pushing, the crowning, of course, this is where the baby's head is almost out. And at that stage, we slow it all down. We help her to breathe off the urge to push. And she's already practiced that. She knows. And of course, that's when she wants to push the most because there's so much pressure. But if we just let her ease the baby out, just to let the baby come gently, smoothly, peacefully, calmly, that can change the history of that baby's birth story. And I know I'm talking to some women there today who, I know some of you have had babies and you know exactly what I'm talking about, that ring of fire, right? So instead of thinking of it, you're burning up in the fire, no, to think of it like it's a burning gate. And it's a beautiful burning gate. And on the other side is a garden, a beautiful garden. And your baby's in there. And all the wise women that you've met, all the wise women in your DNA, they're all over there, the other side of that burning gate saying, come girl, come this way. You've made it, you've made it. And just to take a big deep breath and jump through that burning gate at the end. The birth. The baby's born. This is not only your moment as a mom, we have to teach them, but it's the baby's moment as well. And we can truly, truly affect how that first moment is going to be. The joy. I see it, I live for it, to see the joy of mom and babies meet each other. And if their mom is not traumatized or distracted, she can truly be present to the birth of her baby. She's reached the summit. So the end of the journey, but of course, the beginning of this new adventure for both of you, for both of them. And then the third stage of labour, she must know, it's the birth of the placenta. It usually happens within 5 to 15 minutes. There's no bones to mould. It doesn't have to get smaller to come through. There's usually no long pushing. She might not even notice that we're delivering her placenta because she's in love. She's falling madly in love looking into the eyes of this new little being. But for us as providers, of course, we're very recognising the fact that this can be the most dangerous part of the birth process. We want to make sure that placenta is completely delivered and that her uterus is contracting down around the placenta site, which can bleed. The fourth stage, this is recovery, right? We're cutting the cord, we wait till it stops pulsing, and then the partner usually cuts the cord, and then we're doing skin to skin for an hour, 2 hours, and then the lovely breastfeeding hopefully will start. Recovery, for some of us, it's thought of as the first 48 hours. And then, of course, for most of us, we think of it for the physical recovery to be the first 6 weeks. We see them after their 6 weeks. Is the body returned to its pre-pregnant state? Has the breastfeeding gone well? But for the recovery of the mind, it might be a lot longer than that, depending on what happened in her labour. Did she get the birth she wanted? Did she understand her birth? Is she traumatised? Do we need to help her with that? So I feel very blessed that I'm in a unique position, that I'm a hypnotherapist through HMI, and also I'm a nurse midwife, and I deliver thousands of babies throughout the years. And I have this perspective on it that I can help it as we go along. So why do women ask for hypnosis in childbirth? These are the two reasons I see most often. One, they'll say, I have this strong desire to do a natural childbirth. They instinctively feel that they want to try it, they want to do it, that they know they have it in them, they want to do a natural childbirth. But they say, they usually say to me in these words, I would like to try natural childbirth, but I'm open to an epidural if I need one. So the wording they're using in their mind, they've already told themselves, I'm going to get an epidural. When I hear that, I know what that means. I must teach them to say these type of words. Using self-hypnosis, I will have a beautiful natural birth. I know that if I change my mind at all, I can always ask for an epidural. So they have to see themselves as somebody who is a natural birther, a natural childbirther. So then, of course, the fear, they say, I want to learn how to breathe, how to relax, how to do the self-hypnosis because I'm afraid. I'm afraid of childbirth. They are afraid of other women's scary birth stories. That's all they have in their mind when they think of childbirth. And they say things in their mind, I am in danger or I might die, instead of I am safe in my contraction. We must teach them that a contraction is not a dangerous thing. It's a normal, safe event. Just like your heart contracts when you're sitting there right now, your bowel contracts, your bladder contracts. That's a normal physiological event. And when you're in labour, your uterus will contract. I am safe in my contraction. I make them write that on a piece of paper and stick it on the wall wherever they're washing their teeth or brushing their hair. So the fear, what are they afraid of? So I like this, the fear, tension, pain cycle. It's like what we learn in hypnosis, isn't it? That our thoughts can affect our emotions and that can affect our physical reaction. If a woman is in labour and she's afraid, she will start to secrete stress hormones, and that's going to block the hormones of labour, especially the endorphins that can help her go through her labour. We don't want her to run away. We want her to be present. We don't want her to feel like she has to fight. We want her to feel that she is safe. So if we can reduce the tension in her body, she's going to feel less pain. So if a woman is in fear when she's in labour, instead of the muscles that she can control relaxing, like which is most of her body, they'll contract. So if I'm here and I hear a noise down the corridor and I'm here on my own, I get afraid. I'm like, oh, what's that? Am I in danger? And my muscles will contract, getting ready for that fight. Same thing in labour. But this can contract the muscles around the cervix and around the pelvic floor. No, we don't need that. We want everything down in that area to be soft. So what is she afraid of? We need to figure out what that is. So we need to spend lots of time figuring out what this woman is afraid of. So the hormones of labour, the oxytocin, of course, is that hormone that's going to make her contract. And we have to teach her that more oxytocin means stronger contractions. And that's a good thing, that a stronger contraction is a good thing. The endorphins act as painkillers and give the women a feeling of euphoria. Like when you run a marathon, you secrete lots of endorphins, and after mile 12 you don't even feel your inner thighs chafing anymore. You can't feel your feet touching the ground because you have these natural painkillers. And another time that we secrete a lot of endorphins is when we're deeply relaxed. And isn't that a perfect opportunity when we're in labour? Remember the contractions, that's the marathon runner, and then the relaxin. So she has double the opportunity to secrete endorphins if we can help her feel safe. So the relaxin, that's going to soften ligaments and cartilage and lubricate her vagina. The prostaglandins, again, that's going to soften the cervix. The adrenaline at the end, that's going to give her a great boost to get to the top of the mountain. And then the catecholamines. How much of the catecholamines will she have? Will be equal to how short her labour might be. Some women, when they're completely relaxed and in a state of acceptance, they have really short labours and really strong contractions. So fears, these are the things that women tell me they're afraid of. They're afraid of tearing. Of course they are. Of course they are. Everyone's afraid that their vagina is going to tear when the baby's head comes out. So we make a birth plan for that. We give her a script for that. Pain, she's afraid of the pain. So we practice being uncomfortable and how to talk to ourselves, how to think and how to breathe and how to relax other parts other than the uterus. She's afraid of having a cesarean section. We don't know if there's going to be a special circumstance, if she's going to need a cesarean section, but we teach her hypnosis, how to stay calm, how to breathe, how to relax, even though she's having a cesarean section. It's still a birthday party. They're afraid of bleeding, they're afraid of dying, they're afraid of pooping. I had a woman and she was so afraid that her husband would see her pooping in labour that she wouldn't push. At the end, she wouldn't push. The baby was right there. The baby was crowning. She would not push. Her mind was so strong, and she had hypnotized herself so deeply that she wouldn't push, that she was able to hold on to the baby. It was quite alarming. The baby's head was right there, and I was saying, just a little push, just give me just a little push, just a tiny little push. I was braiding the baby's hair. She couldn't. Couldn't do it. I had to put the poor man out in the waiting room to get the baby out. But that's how strong our minds are. But it was her fear, you know. So we need to make a birth plan. We need to make a script for all of these fears. Failing. Women tell me, I'm afraid I'll fail. How can you fail? You've created a whole human being. You've already won. I mean, there's no failing, there's no good, there's no bad, there's no, fight, there's no reason for a woman to ever feel she's failing in any part of childbirth. She's already a goddess. She's already a super warrior. So where does the hypnosis begin? I like to start the hypnosis the very first minute I meet that woman. I let her know that I am experienced, that she's safe with me, and that I believe in her. Whatever it is she wants, I'm going to help her achieve her goal. I'm going to lead her to the proper childbirth education. Hopefully she'll come to my prenatal yoga so we can really practice. And then she'll have trust in the caregivers that she has around her. And then where she's going to give birth, does she feel safe there? This is really important for a woman in labour. We as hypnotherapists learn the safe place, right? We go into our safe place, we visualise it. Is there water there? Are there trees there? For her safe place is the birthplace. So we help her to visualise a really safe, beautiful birthplace. And then we teach her that she must have the right conversation in her mind. I am safe in my contraction. I am strong. I am wise. I am woman. And then desensitization to pain, because of course a contraction is a huge amount of muscle contracting. So how do we desensitize her to that feeling? We can train her by, placing ice on her skin and holding it there for a minute while she learns how to breathe and relax. We can pinch the skin and she can learn where is the amount that she can take before it becomes pain. We can tie a tourniquet. I love to do that. I'll tie a tourniquet around their arm and I get them to relax everything else in their body. And we watch the clock, we'll do 30 seconds, then we'll try for 40 seconds, then we'll try for a full minute. While this tightness is here, the rest of the body's relaxed. And then the yoga poses. This is muscle contracting when we hold a yoga pose. Early labour, we hold them for 15 seconds or 30 seconds, and she learns how to have the right dialogue. I am strong, I am wise, I am woman. And leading then to stronger, more difficult yoga poses, holding up to 60 seconds. Sometimes they start sweating, they, start to really take in those deep breaths. But then they realise, wow, I'm full of endorphins after the class, and they start really enjoying it, like really getting it, that this is what labour can be like. So I've developed this hypno-yoga birthing class where I've put hypnosis into the class, and I asked them, now this is a beautiful woman doing a very beautiful yoga pose. Most of them can't lift their leg that high, but she's particularly beautiful, and she's one of my hypnobirthers, so of course I had to pop her in there. But we asked them, you know, to learn how to hold the yoga pose, to do the breathing, to control the breath, and to start visualizing what could be happening in their body if they were in labour. Remember the cervix thinning and opening, the baby moving down, everything opening, everything releasing, everything peaceful and safe. Here's some more of my strong, wise warriors. You can see some of these are challenging even if you were not pregnant, but to be 9 months pregnant and holding these poses, they really get the feeling of work. And then here's another little warrior, and she's so wonderful. She brought her self-affirmation, so a big board with all of the things she wanted in her mind written on the board. She had been training herself during her yoga, during her practice, that these were the thoughts that she was having, and just having these affirmations on a board in front of you while you're having a contraction, that's going to be what your thoughts are. So how that works is we use the 5 senses in labour. Right? Something to gaze at. Whatever you're looking at, your mind usually talks about. Right? If you're looking at a picture of your mother, or a picture of your Jack Russell, or a picture of, a statue of Buddha or Jesus or something, what you're looking at, it makes you feel strong, makes you feel happy. Something to listen to, an auditory focal point. We advise the women to bring, their hypnosis tapes, their music. Maybe they could listen to their own breath or their lover's voice. Something to smell, something like lavender or peppermint, essential oils, flowers or herbs. Sometimes we'll, get them to put the herbs or slice a lemon and smell the lemon, and their whole brain is like, lemon, and they can hear Enya in the background while they're looking at a picture of their mother, and they're having a contraction, right? They feel the contraction, but they're aware of all of this other great stuff as well. Something to taste, maybe different flavoured ice pops. And then the touch techniques, because of course our skin is the largest organ we've got. So we invite whoever's around the bed to touch her in a gentle, kind way. And wherever they touch her, it should be gentle. But we practice. And then if a woman does have a traumatic birth, and the special circumstances where perhaps the baby might have distress in labour, or she might bleed, or have a cord prolapsing, a cord coming down in front of the baby's head, or something out of the ordinary, not the ordinary. Remember, these are special circumstances, but they can be very traumatic, whether she's had hypnosis or not. But the sooner we get to her after the birth, the quicker she can tell her story. And in telling the story, she can find the parts of where she's traumatized. And we can pause with those parts and explore them more and help her to process. So sometimes I'll be doing hypnosis very shortly after the delivery, maybe the next day while she's still in the hospital, or the next week in my office when I see her. What was your story? What was the birth story? Sometimes if they need a cesarean section, if it's planned, of course, we can do some lovely hypnosis. She can have a beautiful little MP3 downloaded, and she can practice while she's laying there, visualizing the surgery itself and how joyful it'll be to do skin to skin in the operating room. We let our patients do skin to skin and breastfeeding. And we have music on in there, and it's still a beautiful birthday party. we try to do the same if it's unplanned. It's a little more stressed if it's unplanned. That means something happened throughout the labour. But we continue to do the deep relaxation, the deep breathing, the conversation. You're safe. We're looking after you. Everyone here is on your side. Everyone's on your team. And then the emergencies, especially the emergencies, we need to reiterate to the patient, we've got you. We're going to keep you and your baby safe. Just keep breathing, keep relaxing, keep sending that baby those breaths. And we remind them this is the last few breaths you get to take for your baby. Soon they're going to be doing it all on their own. So make these breaths your best. And then, of course, this is what hypnosis for childbirth can look like. After in the recovery, when they come back and they're telling me about their happy birth stories, and when they look back on their story, they're not traumatized. They look back as though it was the most wonderful, joyful experience. And of course, that makes me so happy. So if you have these happy families, you're going to have happy, healthy babies. But what is it all about, really? We sometimes, I meet women and they're so focused, I want to do a natural birth, I want to do this natural birth, my friend had a natural birth and I want to have that same experience. And we lose sight of what it's really all about. And it's really about delivering, that the mom should focus on delivering a healthy baby. And our focus, for me personally, my focus is getting the baby to that moment of their birth. How can I affect that moment? All of this, preparing the mom, preparing the partners to welcome this baby. So I invite the parents to prepare themselves, prepare to receive your baby, prepare your first words. What are they going to be to your baby? What will you say? What will the first words your baby will hear? Prepare your first face. You know, what will the baby see on your face? Will they see how awful and what a terrible experience? Or will they see this wise, strong warrior that's just climbed the mountain, that she would have crossed any river, got over any boulder, fought whatever it was to get to the baby? Your baby loves you immediately, right? We have to tell the patients that. Your baby will love you no matter what face you have. But let's try to prepare the room, the ambience, whatever music you want playing, your baby's birth song. And it all leads up to this beautiful first moment, the baby's first moment outside your body. If that can be a beautiful, peaceful moment, perhaps the next moment can be peaceful. Perhaps the next 10 minutes, perhaps the next few hours, perhaps their life can be affected by their birth story. This is a brand new birth story, never been told before in the world. What we do can really affect that. And if you have these happy birthdays, happy families, happy babies, then you're going to have happy midwives, happy doctors. So again, thank you very much for letting me talk here at the American Hypnosis Association. I have a wee podcast. It's called The Bleeding Truth. There's no G because I'm from Dublin. And I invite you to come and listen to some of my stories from the labour room. And we have a few minutes if any of you'd like to ask any questions. I see Lorraine there, has her hand up.
Hi, I just wanted to say that it was a wonderful class. I gave birth to my first child 40 years ago, and I did Lamaze, and up until now had no idea it had anything to do with hypnosis. So that was very endearing to find out.
Isn't that interesting, Lorraine? Yeah.
Yeah, I had no idea.
But
no idea.
It's exactly that. It's hypnosis.
And for me, it was all four of my births were natural.
Wow, you're so strong. That's amazing. Good woman.
Yeah.
It's very
So,
hard. Labor's very hard.
yeah, it was, but it was an amazing experience. And
Yeah.
of course, for me back then, it was drilled in there that they weren't sure how medication would react with the
Yes.
baby. So that scared
So I'm
me.
sure what I was talking about has brought back memories.
Lots, lots.
And I see Eric there has a question. Hello, Eric.
Hello, I love the presentation. As a father, it just popped so many things in my head. Like, man, I wish I had this in the room myself.
Yeah.
But is there any special attention that you potentially put towards high risk pregnancies?
Yes, so he's asking about is there special considerations maybe we should have for high risk? And yes. The high risk pregnancies, they need this more than ever because they are already full of fear and they have perhaps a really good reason to be fearful. But education and having your baby in a safe place, and sitting with the patient. Often we have patients that have to be admitted early for weeks, beforehand, perhaps in premature labour or with an ill baby or something going on, perhaps where they know the baby's going to go to the NICU, which is the neonatal intensive care unit. We can sit with the patient and develop scripts and get her to talk about it and pull from her where the real fear is and try to help her to understand. The understanding can really help with that, yes. And then after the birth and after, if she's traumatized, still worried maybe about the baby in NICU, she can come in. Sometimes I'll tape a woman's story as she tells me the birth story in hypnosis. She'll tell me the birth story and I'll tape it and then give it to her so that she can listen to her story and realize, wow, that's what happened. Because sometimes they may be, so traumatized that they've missed a lot of it consciously. But to explore it in a hypnotic state can be really healing. And Tanya, hello Tanya, you have a question?
You just gave me my superpowers back, man. You just reminded me of all of it because 70 and a half hours of labor.
Yeah.
And by the time I showed up, I was already 8 centimeters dilated and I did not get her out for another, by the time I showed up to the hospital, for over 24 hours. And he refused to do a C-section. It was a nightmare in 1993 of all things.
Yeah. Oh.
One thing that brought me to HMI, though, was the discovery that the only reason my daughter and I survived that was that I was doing self-hypnosis. I didn't know it at the time, but I was actually practicing it. It's what survived me and my daughter. The missing piece was telling the story afterwards. I was traumatized. It scared the daylights out of me. Yeah. My adrenal glands were bruised. I'm still having problems. I'm 57 and they're in their mid-30s now and having my grandbabies. So I just love this whole telling the story bit because even though I didn't know what I was doing or have a name for it, that would have put closure on my trauma, if you will.
Tanya, and it's never too late to tell that story. I've had women telling me their scary birth stories in hypnosis in their 60s, in their, and they're still feeling the trauma. And it's never too late to save those adrenal glands.
Remember, I love this. Thank you so much. I've been looking forward to this opportunity and literally since the beginning of my first year. So Great. Dr. Sally, thank you so much.
Thank you. And Heather, you have a question.
Hello. Thank you so much. I loved your presentation.
Thank you.
And right now, my daughter-in-law is 3 days overdue. So I am waiting right now, very excitedly for the birth of my first grandchild. In preparation for that, I did take Lisa Mackenberg's hypnobirthing class, but unfortunately she declined my offer. So you gave me a lot of really good tips to help her in the moment relax. But what would you say would be the most important, crucial step to help and guide a woman through the birthing process who has not prepared?
Well, if she's going into her labour without any preparation, she's going to be okay. She must still feel safe, to create that safe space for her. And that safe space might be your own face. Like if your face is looking all like scared and anxious and worried, she'll pick up cues from that and think that she's in danger. I'm always saying to the husbands or the partners in the room, fix your face. Fix your face, because they're looking like all terrified because they've seen some bloody mucus or something, and then it creates tension and fear that doesn't need to be there. But just to be a calming presence and to be in service to the woman in labour. What does she need in that moment? Does she need a drink of water? Does she need to be stroked? Brush her hair, hold her hand, take her to the bathroom and say the words, "You are safe. Stay calm, take a breath, relax." Honestly, they're the words I use most often. I went to school for many, many years to get a doctorate in nursing and midwifery, and it still comes down to when I get cards from patients, they say things like, "You held my hand, you were there." It's a presence. It's like to just hold her. Some people say it's creating or holding space, but it's think of a little wild animal out in the nature. She'll build a little nest, right? Little animal, she'll build a nest, she'll start to birth her babies, and then the predator shows up. And the predator shows up, she can stop her labour. I see women doing that all the time. If the wrong person's in the room, if the wrong energy is there, her contractions fade out. She doesn't have a lovely, beautiful wave-like pattern like the ocean. No, she's in hiding. She's in fear. So we have to create that safe space as well. We teach her to have it inside herself. If she hasn't prepared that, then we'll help her create it. And you being a loving mother with a little knowledge of hypnosis, that's going to go a long way.
Thank you so much. That's wonderful advice.
I hope it helps. And good luck with your beautiful grandbaby. How exciting.
Thank you.
So thank you very much. I think, I see we have Stacey wants to ask a question. Hello, Stacey.
Hi, I definitely want to make this a major part of my hypnotherapy practice going forward.
Great.
So where do I start with the education? I am currently a birth doula. Where do I go from there?
So you're a birth doula and you're learning how to be a hypnotherapist. Those two are just so perfect. Bringing that into the labour room is going to be like such a gift for any labouring woman. I've attached a few links below. My prenatal yoga class, it's really the hypnosis I've put in there during the yoga poses. You could share that with them if you want to. Also to create the scripts for the particular patients. Like we can do group hypnosis, or you can just get a woman on her own, see what her personality is and see what her fear is. Is it that she's afraid of tearing? Is it afraid of pooping? What is it?
Right.
It doesn't matter what the fear is. That's where our work lies.
Okay. Thank you so much.
Okay, Stacey. And Lucia, we have time for one or two more questions.
Hi, Sally.
Hi, Lucia.
I just wanted to share something quickly. I had two home births, and my first home birth was very traumatic. It was 24 hours, and that was the best day of my life for sure, the day that I met my son. And so for my second birth, I decided to be prepared. So I hired a hypnotherapist from HMI that was certified. And the birth of my daughter was only 2 hours labor. I almost had a free birth because my midwife almost didn't get in time. And the pain, it was so much better. I mean, I still had pain, but every pain, it would just remind myself that I was getting closer to my baby. And that was all the work that I did with this hypnotherapist from HMI. So just want to encourage all the future hypnotherapists here that it's a very beautiful work that we're going to do.
That is wonderful. Thanks for sharing that, Lucia. That makes me so happy. I see the women who do the hypnosis with me. I see their births. I'm so lucky I get to then be with them. And honestly, I've been with women birthing their babies where we don't even have to say anything. That it's peaceful, it's calm, her music might be on, she's just listening to her breath. And we just give her little prompts like just smile into your baby or breathe into your baby. Sometimes if they start getting a little panicky or having a hard time, and we might be already in the pushing phase, the second stage, I'll just come away from the end of the bed and I come close to her ear and I'll just whisper in something I know, something that will suit her personality and that will just go right into her heart. And it could be something like you're about to meet Brendan or Mary or whoever the baby is, you know. Go get your baby, warrior. So how wonderful. Thanks for sharing that, Lucia. Is it Asiai?
Asia, yeah.
Asia, lovely.
Yeah.
Hi.
Thank you so much. Wonderful presentation. I can't say enough how I enjoyed it. Thank you so much. And your presentation brought me into like, I can be helpful because like other women who talked about, they did give birth like naturally and not knowing that they're doing hypnosis. I was the same. So that is very helpful to me to look into my career this way. I just want to know if OBGYNs are open to hypnosis nowadays, or is it easier to go that way or towards like doula way, or how do we do it?
Well, women have to understand that this is their experience and they have to realize how powerful they are. You can go, of course, to your nurse midwives, your home midwives, your OBGYNs, whoever is going to actually be with you for the delivery of your baby. You're the one delivering your baby, you know, and you do it your way. You decide what position your body wants to be in, what form of birth pain relief you want to use. You can even go in and say, I want a C-section if you want to. So yes, I don't know any obstetrician who would say, no, I'm not going to have any hypnobirthing. No. We have women now, they come into the hospital, they do hypnobirths regularly, all the time. There's usually one on the floor doing hypnosis, and we have a little sign we put on the door, we are a hypnobirthing family. So whoever's coming through the door, they're already themselves hypnotized coming through, knowing that there's a different feeling, a different vibe, a different focus. Somebody there brought up a really good point that some women, they just naturally do natural births, and I see that all the time. Sometimes I deliver women who come from other countries that have never had a chance to go to a childbirth class or a prenatal yoga class, and they just know how to do it. I wish we could bottle that. They just instinctively know. They've accepted that this is natural, that what's happening in their body is completely natural, and they just do it. And they're so strong and they're so wise, and they are women.
Like reaching pregnant women, right?
Yes.
That's what you recommend,
Yes.
not through doctors.
Yes. But So the more support you have, the better. Like a doula, of course, is a woman that you would hire to be with you, to help you with the comfort techniques. The midwife or the obstetrician, they're the ones that are going to be right there as the baby is being born. But the more people involved in your birth plan and in your the way you've decided you want to deal with your labour, the better. The nurses are all great. Most of the nurses that I work with, they're like, yay, we have a hypnobirther, you know, and they're only too willing to help in any way they can.
Mm-hmm. Thank you.
You're very welcome. And I think that's all the time we have, and I really appreciate your attention, and I hope that you all go out there and find some pregnant women and help them have a better experience in their birth. And in doing so, you're helping those babies experience their birth story in a different way. Thank you so much.